osteomalacia. This is metabolic disorder appearing at the age of adulthood due to deficiency of the vitamin D. Vitamin D is not synthesized within the body of the human being. It has to be attained from the outside. In the foodstuff, nutrition, and through the sun rays of ultraviolet rays of the sun. This is a natural source of vitamin D. So regular sun bath in the early morning for at least 1 hour in the naked form, undressed position, that is actually wanted so that maximum ultraviolet rays get entry in the skin and that produce the vitamin D under the skin by the aid of cholesterol. The food stuff which contains some quantity of vitamin D, that is milk, fish, eggs and dairy products, while the calcium and phosphate can be obtained from the vegetables and the various fresh fruits. Also, milk, cow milk and other milks of the animals produce excessive amount of calcium. So if there is malnutrition, that is the nutrition which is being taken by the person is deficient in vitamin D and calcium phosphate, that will be responsible for the production of the osteomalacia. Otherwise, if there is sufficient quantity of these elements in the foodstuff or the nutrition, there is some pathology in the intestine, the small intestine, that produces malabsorption. There is some factors, especially celiac disease, Crohn's disease, and other pathologies of the intestine, chronic inflammatory diseases, tumors, they hinder and produce obstruction in the absorption of these elements. So this factor is the main factor that produces deficiency of the vitamin D, calcium, phosphorus in the blood. In addition to the limited quantity of the provision of vitamin D from outside, when person is working outside and avail the sun rays. So vitamin D is compulsory for absorption of the calcium, phosphate and entry of these minerals into the bones and deposition in the osteoid tissue of the bones, which strengthen and produces density of the bone and strength of the bone. When the quantity of calcium, vitamin D, phosphorus and phosphate is decreased due to these reasons, in addition to these, there are also certain chronic diseases of the liver and the kidney. They also contribute to the production of this osteomalacia. So when there is decreased level of these elements in the blood, parathyroid glands is stimulated, become overactive and produces excessive amount of the parathyroid hormone, and that produces mineralization or decalcification of the bones, due to which the calcium phosphorus passes from the bone into the bloodstream. So the bones become weak, fragile and more prone to the fractures after even slight tenderness and pressure. So the actual quantity of the vitamin D, calcium and phosphate is sufficient for the eradication of the osteomalacia chances. So first is the provision of these elements in the good nutrition.